Hi there, this is Dr. Michael Shear with LearnLOCATOR F-Tx, a comprehensive clinical and laboratory education for the Zest Dental Solutions LOCATOR F-Tx fixed attachment system. You know our patient shown to you here in this image. This is our patient. We demonstrated the F-Tx surgical and prosthetic procedures in earlier videos. Now we have her approximately 3 to 4 months after the surgical procedure, been wearing the F-Tx prosthesis successfully. Overall, she is very happy and is ready to move on to our next procedure. At this point, we're ready to now go ahead and remove her F-Tx prosthesis using our prosthesis removal tools, instruments, or the bar and loop system. As shown here, we have all 5 of our dental implants fully integrated with appropriate soft tissues completely surrounding the dental implants. Now our goal is to go ahead and recreate this patient's dental arch and dental implants with the F-Tx abutments via a final impression PVS as well as a stone model pouring technique. First and foremost, we need to go ahead and get ready for the PVS final impression. So now we've gone ahead and we are now going to demonstrate using the impression copings for the F-Tx system to make our final impression. First and foremost, we take out each individual impression coping and seat it directly onto the F-Tx abutment. When I seat the coping onto the abutment, it creates a snap, fit, and audible click. The idea of these copings is that it has a black processing mail on the inside of the impression coping itself, which is essentially analogous to the traditional Zest Dental Solutions locator impression post, which is a top hat design. As I place these all onto each individual F-Tx abutment, you can see the orientation of the impression copings. You see here that the initial placement is quite off-angled, and multiple directions of the impression coping are determined. The nice thing about the impression copings with the F-Tx system is that I can easily reorient the impression copings. The impression copings are initially placed on top of the F-Tx abutment at that off-angled. Now the impression copings have a snap-in black processing ball that is going to snap into place. I can easily take my fingers in between the buccal and lingual slopes, correcting any sort of angulation of the actual implant and abutments. Now looking at the reoriented impression coping view, you can see here that I have all of the impression copings at a similar path of insertion. Even though the implants and abutments are at a predetermined angulation due to bone morphology, I'm going to reorient the impression coping to help correct for that similar path of insertion. After verifying my reorientation of the impression copings, I'm going to size my custom tray to fit on top of the copings. Alternatively, you could also use the chairside stock impression trays. What I'm going to be doing with the custom tray is I'm going to be using a combination of the chairside light and chairside heavy body VPS. I've applied adhesive to my custom tray and allowed it to fully set up, approximately 5 to 7 minutes. Now what I'm going to do is lightly air dry the impression copings and the edentulous ridge. During this, I'm going to then start liberally placing the light body VPS chairside material over the impression copings and the ridge. While I'm injecting, my assistant is filling the tray with heavy body VPS. Instructing the patient to keep their jaw, lips, and tongue in a relaxed position, I seat my impression tray on top of the edentulous ridge and the impression copings. During this time period, I have the patient relax her jaw and border mold buccal, lingual, just like I would do for a standard complete denture. It is important to do some minor border molding here to assist our laboratory technicians in creating the final prosthesis. After the material has been fully set, approximately 5 to 7 minutes, I gently tease out of the mouth. It's normal to feel some resistance here from the impression copings snap fit in the F-Tx abutment. This is my final impression, now ready to send to the laboratory.